thank you all for having me here today. And so just so excited to be able to with you all a little bit about um, ACT Plus. And um, it's all about building a healthy community, but more importantly, a collaborative approach where we're coming together, bringing all of our resources together to do some important work in the community. Um, So how did we get started? Well, we got started with Drs. Roosevelt Campbell and Dr. Andrew Flynn. And Dr. Campbell said that Dr. Viviana was his mentor and encouraged him to do this. He just said, I remember when I first met him, he said there were just some things he was seeing in the African American community was just devastating around COVID-19, and just started reaching out to various people and say, can we come together and just form a task force to just work to make sure information is getting out into the community where the people are. And so many of us just said a resounding yes. And we actually ended up, Dr. Viviana, having two meetings because we were so excited. We had people that wanted to get together at 12. And then if there were folk in the community that were working, we do another one after 5. But that's how committed we were. And we said, but we at least, at some point we want to be able to have just one. But that's how we got started. I can't believe it's just it's been almost 4 years. So some of the activities that we started with when COVID first hit, the main focus was on response to COVID, the pandemic, what was going on. And what we really did was a lot of advocating for providing services in the community. At that time, there was work trying to get people to come to buildings and other places to get the vaccinations. And we were saying we need mobile units. If it's not a physical unit, can we get some people and some vaccines and get it out there? So we really did a lot of advocating, working with our colleagues at Duke saying, can we get that vaccine out? Working with the health department saying, can we go where the people are? And a lot of resource distribution, just making sure people got the things that they were needing. And so that was PPE, it was mask, it was hand sanitizer, it was food boxes, and just educational materials that were that need to be accurate. And so, and working with you all at Latin 19, we saw the challenges when you'd get material and we said, well, this is not in Spanish. And so what, this isn't going to work. And I was very candid with people saying, this is not going to work. So, let's step outside the box and think through how we need to do things differently. And then when we got the vaccination clinics working with Latin 19 and Duke and the health department and other partners who are on this call, we really took the time to listen to the community about what their needs are. So the vaccination clinics were spaces and places where it wasn't just getting a vaccination, but it was also getting access to other resources. And that's a model that people continue to utilize in the community. And when people ask, well, how did that happen? And we said, we just listened to the people that we were trying to help. And of course, we also had the wonderful community health workers who were already there in the community with established relationships, trusted partners, and sharing information. I want to share here, Viviana. Many of you may remember when they were trying to automate registration for vaccination clinics, and the information was in English. And then there were connectivity problems. And I think one of my favorite meetings here at Latin 19 was seeing the community health workers in the field. And they're just saying, see, I have an iPad. I have no connectivity. And the forms that I have are in English, so it takes longer. And so it was just having that and people saying, oh, okay, but that is the level of commitment that people within Latin 19 and also within ACT Plus, when we were out there in the field, we really wanted to have that lived experience to help inform the work that was being done in the community. And so now that we've moved a little bit past the major pandemic, the evolving focus for for ACT Plus is around some of the other health disparities that we're addressing. And I just put two here as an example. So we haven't stopped with COVID-19, but the plus is we know there's some other things that we need to address. Maternal mortality in Black women is incredibly high in North Carolina. And so that is an issue that has come up in meetings, including mental health issues for our pregnant women, and also chronic conditions in African Americans. And in North Carolina, there's just higher rates of chronic illnesses such as heart disease and diabetes and several cancers. And we are seeing some of this also in the Durham County needs assessment. And for those of you who participated, there's some data that's come out about that. And it's showing that we still have a long way to go with some health disparities in our community. So it's important that we still continue to work together to get these looking better. So I always say the challenges create opportunities. We had some challenges, but yet we have always been able to come together to really there's some opportunities to do some wonderful things. So some of the challenges that we faced and are facing with ACT Plus is that it is a coalition. We're not a nonprofit. And so we had received some help in terms of people with Leatrice Martin out of from Duke. But earlier last year, all of that support ended. So it now is housed under the African American Community Collaborative under Dr. Angelo Birch, because we did not want that to go away. So we assumed that, and also some administrative responsibilities. And so it's challenging when you have those limited resources. We don't have a lot of money. We've also had a shift in meeting schedules because Dr. Birch and his nonprofit organization are sponsoring the Zoom meetings, and he has limited resources. So we're only meeting twice a month. And so wish we could meet more frequently, but funding only allows us, and sponsorship is twice a month. And we also have fewer partners. And it's because when funding left, some of the funding that some of our partners received during the pandemic, it went away. And so their capacity is limited now to do some of the work that they once did. And so we're hoping that working collaboratively, we can get some funding back to increase our meetings, and also, more importantly, to help our partners get back up to the spaces and places that they were at to help. The potential opportunities that we've had civic organizations. We're starting to reach out. It's getting warm. People are going out into the community, and they're really wanting groups to come and do some community education, either at social events and fairs or at meetings, either through Zoom or in-person opportunities. And we've also had some reach from health ministries and the faith community. They were such a big help early in the pandemic, opening up spaces, and they'd like to continue to do that with ACT Plus, with Latin 19 and others, and say there is still some important education that has to happen. COVID hasn't gone away, and we have other issues, and they like the idea of working together. Most recently, there are some churches in the area that received funding through the Durham County Department of Public Health to do some more COVID education in the community. So there's lots of opportunities for us to work together and collaborate with groups to get some much needed education out in the community. So I'm here just to say, let's continue to build healthy communities together. We did so much wonderful work together and we can continue to do that work. So we meet on Tuesdays at noon, twice a month, and we're doing this via Zoom for about an hour. And I put my contact information here, and you can also reach me through Duke, but let's leverage what we've been able to do together already and just continue to push forward and do even more. So that's all I really had today, but just wanted to yeah, just say let's just continue to do the work together. I know there's some of my colleagues here who are I saw a couple from the Duke Cancer Institute that will probably tell you about some things, and just got off the phone with one about doing some work in the churches. But that's the kind of work we need to do. And other work that I would like this group, Viviana, to come back. I would like to come back with my Duke hat on and talk with you all about an initiative that I'm very excited about. I've been given the opportunity to raise a multi-faith advisory council, and I said it has to be multi-faith and multicultural. And I really just stood upon that, and they said, okay. And so I want to come back and talk with you all maybe next month or soon. I'm really excited about it. Can you tell? And talk with you all about, you know, what that really needs to look like and where we need to be reaching, because it has to be, I said, it has to be multi-faith and multicultural. And so I look forward to an opportunity to come back and talk with you all about that. And so thank you all so much, and happy Mother's Day to all the mothers. And please, if you have any questions, I'll be more than happy to answer.